Nigerian healthcare providers to the province and to encourage those already living here to become healthcare workers. Adegoke Fadare is the president of the Association of Nigerians in Nova Scotia. Sir, what will you do with the recent funding from the province to help recruit healthcare workers here?
Well, first of all, I say thank you for having me, and I'm great to talk about this. It's important for this. Funding is critical. We know that the healthcare system is what it is right now, and as an association, we feel like it's important for us to be in the forefront of helping solve some of these problems regarding the healthcare professionals. So there are two critical things we plan to do with this funding. The first, obviously, is to create some research around the barriers that immigrant healthcare professionals are presently facing and how they're not able to either assimilate or to get into the system as quickly and as effective as possible. Why do I say that? We presently have 43 Nigerian doctors who are from UK here in Nova Scotia, and in the last few years we've seen 20% of them leave. So we want to be able to discover what is the reason that people are going. So we want to be able to figure out what that is so we can mitigate, reduce, or lower those barriers. Secondly, what we're intending to do is also for us to be able to come up with different marketing videos and info sessions in which we're going to be reaching out to various Nigerian doctors across the globe. Presently, in the last few days, I think, we heard the College of Physicians and College of Surgeons lift up the reason or the compulsion for you to write, the medical exam coming from US. And we have 77% of Nigerian black doctors in US are Nigerians. We want to be able to see how we can bring some of them over. Or since the announcement, we've been getting calls across the globe from doctors in Saudi Arabia, UK, and the rest. So we're hoping to do some incredible things.
And so what do you tell the Nigerians in particular who you are trying to convince to come here? What's the pitch?
So one of the things about Nigerians is the fact that we love adventures. We like to, try something new. We like to go new places. That's why there's hardly anywhere in the world that you probably not see Nigeria. There's actually a joke that says, if you go somewhere and don't see Nigeria, please get out of the place. So, but the truth of the matter is, Nova Scotia is an amazing place, right? You enjoy the ocean view. You enjoy the luxury of enjoying the seaside view without the hustle and bustle of a big city. And for many of us, as we begin to get older and have kids, our desire is to look for a more relaxed life. And Nova Scotia seems to offer that opportunity. Like I tell people, the reason why people stay or leave a particular place is simply because of the experiences they have and the ties that they develop or they build. And that's what the association offers. So we sell people an experience, and we also sell people an opportunity to develop new and stronger ties. And some of that becomes compelling reasons to come. I can give you a quick example. I think it was in Dallas University, it's a particular department. I'm not sure whether it's the psychiatric department. There was a Nigerian who came from Ireland, and she was able to draw other Nigerian doctors to come to that department. And one of the reasons why she was able to do that was because of connections that she had created. So Nigerians like connections. We like to be, in touch and to stay in touch, and that's some of the things that we're hoping to use to draw people to come over.
You alluded to that earlier. We've heard a lot about issues around some international healthcare workers having insufficient training, in Canada's eyes at least. How comparable is the Nigerian healthcare worker to the Canadian healthcare worker, do you think?
So it's amazing when I hear that. I think obviously there's some issue regarding having to update some of our information, right? Many of these doctors who, for example, come from UK have been trained for 10, 15 years working in UK. These are not people who are recently graduates or any of that. These are people who are at the high levels of their careers, who have been successful, who are looking for new opportunities and new terrains, right? So the issue is that the system needs to begin to look and review itself. And that's why I'm happy when I heard about the news about the College of Physicians and Surgeons in Nova Scotia, realizing that if you're a doctor that has been licensed to operate in America, you should be able to work here without having to do series of exams. I see some of our doctors who are still acting as researchers when they come to Nova Scotia. We need their hands. We need them to be deployed. We need them to be included as quickly as possible. But rather than do that, we are putting them in places that that is way beneath their experience, way beneath their expertise. And I think it's important for us. I'm hoping that the one that from US is the beginning of all these review processes, because they will suddenly realize that the competency required is already available, and it's important for us to begin to engage them.
Sir, great to get your comments on this tonight, your thoughts. Thank you very much.
Thank you so much. I'm honored to be here. Thank you.